Good afternoon. It's Wednesday, April 15th. I'm Gary Pace, Public Health Officer in Lake County, and I'm giving the coronavirus update. Priscilla Morales is going to be doing the Spanish language video and a separate video on Facebook, so you can get that if you want the Spanish language. So the numbers now are in the United States is 610,000 cases with 27,000 deaths. California has 26,000 cases and 790 deaths. The curve is still far lower than we were expecting at this point in time, and it's clearly because of all the social distancing and the shelter in place that everybody's doing. Sonoma County now has 158 cases. Lake just got a 6th case today. This new person is in the hospital and is stable. We are currently getting information on the contacts and on where the person probably got the infection from. And so we're trying to track down to see if there's any community spread and how we can sort of contain it. We're not going to give any other information at this point, but it really brings into emphasis the importance of continuing to stay at home, continuing to wear masks, continuing to wash your hands and do all the things to protect yourself and your family. So the other 5 people, 3 out of the 5 are already off isolation. Everybody's doing well, and there was no sign of any transmission outside of the families in those cases. We've done approximately 300 tests so far, and these 6 are the only ones that are positive. There's still quite a few pending. So I want to talk a little bit today about wearing masks, because Sonoma County just put into effect an order that's mandating everyone to wear masks when they're outside of their house. And I'm not going to do that kind of order at this point, but I think it's really a good idea for people to wear masks whenever they're out in public, because the point of it is that if you wear a cloth mask covering over your face, if you're starting to get the infection but you don't have any symptoms yet and you don't know you're sick, it will prevent the transmission to other people. So when you're out in the community and you look around and people have these cloth facial coverings on, they're actually protecting you by doing that. So you should be grateful for all of their attention to your health, and I would encourage you to do the same consideration for them. This is particularly true if you're around vulnerable people like elders or people with chronic medical conditions. We really want to protect them. Other people that don't have the chronic medical conditions may do fine if they get the illness, but these other vulnerable folks, it can really be a problem for them, and so we want to do whatever we can to protect them. The other thing to emphasize is this is not the N95 mask or the surgical mask. This is cloth masks, cloth facial coverings, and you can use a bandana or a t-shirt around your face if you don't have any of the other ones, or you can get a design off the internet or off our webpage at the health department. The last point I want to make is that there's a lot of people that seem to be coming up from the Bay Area to vacation homes or second homes, and we really want to put a stop to that if at all possible. We understand that these may be people's homes that they use to retreat to, but the simple fact of them traveling across the county lines is increasing the risk for people in our community. So if you're thinking about traveling to other counties, I want to discourage you from doing that. And if you know friends or other people that might be coming up from the Bay Area to stay in a B&B or to come to their vacation home, please discourage them from doing so, because they increase the risk for everybody in the community. So I think that's it for today. Thank you very much, and be careful out there.